Good evening, Dr. Mustafa here. Today I would like to share a very important and very common topic that I think most of the people, they struggle with. This is actually the bloating. Now the bloating is a multifactorial problem that is actually, we know very well, it can come from the stomach and it can come from the even large bowel. So let's talk more precisely about the stomach. Now, why so? When we talk about this bloating thing, this can be one of the symptoms that related to what we call reflux problem, and we know that reflux problem come from also from another multi-factors. Is come from number one could be because of what we call hiatus hernia, which is the junction between your esophagus and the stomach have a bit of loose muscles that can cause you all the symptom of bloating and discomfort, can come also in another form in a matter of what you call heartburn, chest pain, difficulty in breathing, feeling of bitterness or sourness in the mouth, or what we call a lot of atypical symptom of running nose, of what we call exacerbating of asthma or exaggerating of asthma. Then on the other hand, when we talk about the reflux, is actually can be also because of, not only that, because of masala weight of the body, where is actually the weight of our body is more than the usual, and this is where increase the intra-abdominal pressure and cause the patient some sort of reflux. And the other factor is actually also when we talk about precisely about the increased acidity in the stomach. And this is where we talk about the stress factor, the type of food, the alteration of food habits, and so forth. Now, one of the very important factors that we never realize is actually that increased acidity in the stomach, which we always stress, or the way how you eat, is also can be because of what we call Helicobacter pylori or the H. pylori bacteria. Now, why is so special about this H. pylori bacteria? This H. pylori bacteria, in the past, they thought we may have it from outside also, but they found all of us, we do have that H. pylori bacteria. So now, how we can treat this H. pylori? Do all of us have this bacteria as an active bacteria in the body? It is actually not. Usually it is there, and it will cause the problem for the start from the increased acidity, increase the signs and symptoms of reflux to the level is actually can cause ulcer and even can cause cancer in the stomach. And this is a special category, we call it H. pylori related gastric cancer. Okay, now let's go back about the history. Okay, where we've been before in the treatment of all this acidity and problem in the stomach. Now, in the past, when the people, they do have all this ulcers or acidity, when they used to cut in the stomach, and what they do, they go and cut the nerve that supply the stomach, and that is actually the nerve that increase the acidity in the stomach. We call it the nerve of letter jet. And that actually is a surgery. So can you imagine, it's just a surgery to go and cut the nerve. But on the top of that, that nerve is actually not only responsible for the increase of the secretion of the acid, is also responsible for the movement of the stomach and the patient. You treat the problem of the reflux or what we call the acidity, but actually you create a problem of bloating and so forth. And over the time, when they got to the discovery of what you call the medication that reduce the acidity in the stomach, and another time what they call it the PPI, proton pump inhibitors, they found you don't need to do that, because it's a matter of giving a medication that can actually help you to reduce the acidity in the stomach, and at the same time to save yourself from doing unnecessary surgery. So that was actually a big shift in the paradigm in the treatment of the acidity and also in the stomach when they found one single medication. Now, can you imagine if you can find a medication that can help you to treat the H. pylori? Now, what is the classical way of treatment of the H. pylori, Helicobacter pylori, is actually by giving the antibiotics. And the antibiotic, what we call the eradication therapy, two types of antibiotics with some medication to reduce the acidity that can help you to reduce or eradicate or take off of the bacteria between 70 to 80%. So still there is possibility of 20 to 30% that is still inside, which you have to repeat the treatment. And if it is failed, the treatment in the second time, then you have to go to the second line. And if it is failed, then you have a problem of what we call bacteria resistant. That means whatever you give, then you cannot treat the H. pylori bacteria. Now, what is the problem with that? H. pylori actually, it lies to live in acidic environment, and that acidic environment by itself is actually will cause you a lot of problem, right? So now Let's talk about something very precise. Now, when we have the shift in the paradigm, the treatment of the ulcers from the surgery to have a medication to reduce that, now we have a new shift in the paradigm when we have to start a new era of having some medication or bacteria that actually can treat your bacteria. What is that? Then when we talk about, we cultured some good type of bacteria that can help you to get rid of the H. pylori. Now, this is the one of the medication that is considered the new innovation, or is actually a gut probiotic. Have a special type of bacteria, lactobacillus bacteria, special species. They're able to actually to isolate out of 700 types of all these. What it does, have a very good mechanism. You can find the bacteria, stuck to the bacteria, and flush it away from the body. Can you imagine that you have some remedy that can treat the bacteria in your body, whether you have active bacteria or not? And this, at the same time, what it does, it will just go mix with the bacteria and take it in a very gentle way out of the body without the necessity of having antibiotic, without taking the risk of antibiotic resistance, which is a bigger problem actually. And this something can help you to treat, let's say, a detox for H. pylori. So we know that when we talk about, we know that although we're talking about the good bacteria, or what you call probiotics, that is, everything is what related to the probiotics or the good bacteria in the colon. But this thing have a special capability to act and function on the stomach itself. Now, on the top of that, when you have a stomach empty of H. pylori or the bacteria, what it does, that by itself, it will soothe down the stomach and will cut the acidity in the stomach. And this by itself, we found out, is actually will improve the bloating in the stomach. And this is where we are blessed to have something that is not functioning as a treatment only, but it actually will make us away from unnecessary side effects of acidity in the stomach. And one of them is the bloating. And the bloating by itself, there are some treatment for it, to give a medication that to reduce the acidity, to reduce the gas. But one of them is actually, we found a probiotic can help in reducing this type of bloating and keep the stomach in a very healthy environment without the necessity for long-term medication. Although they found from this type of probiotic, you can get even an effect on changes maybe within even less than 2 weeks. And this is all an evidence-based. A lot of study is actually been done for this culture type of Helicobacter pylori probiotics. And this is what today I would like to share with you guys. This is one of the new innovations in the treatment of H. pylori and bloating also as well, for those people who have chronic problem that cannot resolve with a simple medication. We're looking forward for this type of good innovation that will help our patient to get rid of all the stomach problems. For that, I would like to say thank you very much.